Now we'll see healing of skin wounds. So in skin wounds, like the healing will take place with the help of regeneration also and repair. Simultaneously, this process will go on. But mainly in the exam, they will ask you what is healing by primary union and what is healing by secondary union. So there are few characteristic of the wounds will be there which will lead to the healing by either primary or either secondary union. In the primary union wound healing, the wound characteristic, that wound will be either the wound will be clean, uninfected, then the margins of the wound will be approximated with each other, then surgically incised wound, and there is no loss of much tissue in the wound area. So this kind of wounds which are having this characteristic will take place healing with the help of the primary union. So what will happen? The rest of the steps of the healing, they are the same, those what we have seen in the regeneration and repair. So the bleeding will be there, then your inflammatory phase will be there. After that, epithelialization, that is the proliferation of the epithelial tissue will be there, granulation tissue formation will be there. Ultimately, there is a process of the scar formation. Here you can see everything in the image. There is the blood clot, that is the hemorrhage and inflammation, then granulation tissue formation, and finally the scar formation. This is about the primary union. Now let's see healing of the skin wound with the secondary union. So this all the characteristic which I told you for the primary union wound, opposite to those characteristics, the wound characteristic will be there in the secondary union. So first is the wound will be infected, surgically it is not approximated with each other. If it is a very large skin wound, or the much loss of tissue will be there in the wound. So this all type of wounds will take place healing with the secondary union. So at the end result, you will see a very dirty and large area of scarring. This is the healing of the skin wound with the secondary union. This is the image which is showing you same process of wound healing. You can see this is the hemorrhage, and then there is a proliferation of the granulation tissue and a big ugly looking scar. There is collagen deposition which is there.